I like the moving card.
Rolling.
Awesome. We're good to go?
Yeah.
Okay, awesome. So I am Monisha Jones. I go by Mo, and my business is Major Health Moves with Mo. And so I've been doing health insurance I'm approaching 5 years. This summer will be 5 years. And I kind of just like fell into it, to be honest. Like I didn't have a dream like, oh my God, I want to be a health insurance agent, obviously. But I pretty much just fell into it. And so, I mean, I've enjoyed it ever since, just kind of educating people, especially in my community, because a lot of people are uninsured or they know nothing of insurance. So it's really important to me. So I like to educate where I can. And so this presentation is just going to be health insurance 101, just getting down to the nuts and bolts of what makes a good health insurance plan. Okay. All right. So when people shop for health insurance, these are the basics that they have to look for. Okay. You always want to make sure you can afford your premium, which is what you're going to be paying on a monthly basis, right? That's a given, because you don't want to, be paying into it 6 months and then no longer can afford it, and now you have no health insurance and you wasted money, right? You just threw money away. So premium is what you're paying on a monthly basis. Deductible, co-insurance, benefits, which is basically what the insurance covers, and then pre-existing conditions. Okay, we're going to get into it. And let me know if y'all have any questions. Okay.
What's co-insurance?
Oh, we're going to get into that.
Okay.
Oh, yeah. We're going to get into it.
I've never seen that. So.
Absolutely. Yes. I'm going to break it down for y'all. Okay. So premiums, like I said, it's the amount you pay on a monthly basis just to simply have the insurance. Okay. Some people pay nothing if they can get a good subsidy through the marketplace. Some people pay, depending on how old you are or how big your family is, you can be paying a lot of money. Okay, so if people are working in the corporate world, typically they're paying 50% of their plan, or the company's paying 50% of their plan. Okay, so say for instance, there's an employee, they have a family, right? So the company is paying $1,200 total for their plan, but the employee is only paying like 50% of that. So it breaks down weekly, so forth. But when you're self-employed, you're paying 100% of it. Okay, there's no help there, and that's the beauty of shopping around and knowing what you're getting, right? Let's see. So deductible. People don't pay attention to this, but it's very important. You can have a plan with like a $0 premium, but still be paying out the bottom towards your deductible. Okay, so simply right here. So your deductible is the amount you pay out of your pocket before the insurance company kicks in. Right? So let's say, for instance, this example, this monthly premium is $433, okay? But your deductible is $9,100. Exactly. And so, yes, I'm paying $433 every single month just to simply have insurance, right? But then every time I go into the doctor, every time I seek medical treatment, I'm paying out of pocket to reach that deductible.
Out of pocket maximum?
The out-of-pocket max is $9,100. So on worst, if it's your worst year ever, that's the max you would pay out of your pocket.
I better break something.
It'll be more than breaking just something. That's like a hospital stay, maybe a surgery, like all of that. So worst case scenario. And deductibles vary. I mean, you can get plans that have deductibles $5,000, $75,000, $7,500 rather. Sorry, $10,000, and then there are plans that have no deductible. No one knows about that. They're like, what? I can get a plan with no deductible? Yes.
But you have higher premium?
Not always the case. No. Talk to me.
Tell us more.
You're right. Yes. There are plans that are called underwritten plans where you have to medically qualify, lower premium, and no deductible. It's all about qualifying. So co-insurance. So it's basically the split on what you pay versus what the insurance company pays. So imagine again, like you have your monthly premium is $433 a month, and then your deductible is $9,100, right? And now after your deductible is met, typically your co-insurance kicks in. Okay, so insurance company pays 80%, you're responsible for the remaining 20%, and that's per claim. Right, so if someone went to the doctor's office Insurance company is paying 80% of that doctor bill, and then you're responsible for the remaining 20%. Okay. So 80-20 is going to be your best. And of course, you have 70-30, 60-40, 50-50. I don't recommend those. So 80-20 for sure. But then again, you have plans that you don't even have to worry about your deductible or co-insurance.
What happened to the $10 deductible or the $25, $50 deductible,
There's some plans out there.
which is different than what you're speaking about?
Absolutely.
Okay.
Absolutely.
Like a doctor visit is a certain cost. It's just like emergency room or something.
Oh, absolutely. And so, okay, so say for instance, we're going to a doctor visit and it's $150, right? You still have to pay towards your deductible. So you're paying 20% of that. Insurance company will pay 80% of that. Your 20% is going towards your deductible every time.
Mm.
Every time. So you're not paying the entire, doctor bill. You're paying a portion of it. Okay. Any questions on co-insurance? All
Can
right.
you use a secondary insurance to pay for your college?
No, not for your co-insurance. But some people do have two like health insurance plans. So it's not against the law to do that. But of course, you're still paying extra depending on how much your premium is. So it's all about what makes sense for you. And then we have benefits, simply what the insurance is going to cover. So some people, they see themselves not needing like mental health services, or they don't go in for like any doctor visits, whatever the case is. But just whatever you feel like you need in your life, make sure your plan covers that. It's nothing worse than getting a plan and you finding out it doesn't even cover you to go get blood work, or it doesn't cover x-rays. Now you're paying out of pocket for all those things. Okay. So the benefits is just simply what's broken down in the actual medical plan about what is covered in the medical plan. Okay. And typically some insurance plans, they do list out what it's going to cost you. So on the right, we have, on the right, this is a sample from the marketplace. Okay. And so let me go back here. So this Blue Cross Blue Shield plan, that's a sample from the marketplace. And when I say marketplace, I mean like the ACA, the Affordable Care Act, the Obamacare, like the government plans. Okay, so that's a sample. All right, again, $433 premium, and that deductible is $9,100. Okay, and now let's go back to the actual sample of the benefits. Okay, so this is the same sample from that same plan. So of course, being that the deductible is so high, you're paying full price for everything. So as you see for labs and imaging, x-rays, CT, MRI, blood work, you're paying full price. Okay. Doctor's visits, your primary care physician, whether that be you going to get like a physical or something like that, or just like a regular typical doctor visit, that's how much you would pay. Physicals, always free of charge. No charge when it comes to that.
Oh,
Yeah, through your health insurance.
preventative.
Preventative, exactly. Mhm. Alrighty, and then pre-existing conditions. Okay, so it's literally the baggage that you're coming to this new plan with, right? It's whatever health condition, whatever it is that you have going on when you come to a new health plan. So when it comes to certain plans, like an underwritten plan, you want to make sure you discuss what those pre-existing conditions that you have going on. You have to discuss them. You have to tell, or you'll risk getting a decline or something not being covered. Like for instance, if someone just recently got diagnosed with diabetes,
I didn't know.
say they recently just got diagnosed with diabetes and they didn't disclose that, and the insurance company finds out, then all the testing and the medicine that you need for your diabetes is not going to be covered. So, and diabetes medication is very expensive. Yeah, I had that happen to someone. They just didn't disclose it, and it wasn't covered. Wasn't fun at all. So yeah, always just disclose anything that you have going on. Whether it be like, oh, I broke my ankle in 6th grade. That's not going to matter, but it's important to know.
Does it change your premium if you disclose something? Can they charge you more because of pre-existing condition?
No. It would just determine, depending on how severe it is, you may have a waiting period towards that. So like for instance, if it's, say for instance, someone had, let's see, what's something?
I had a situation like this.
Okay.
I went to the chiropractor
Mhm.
just because I wanted to. And they said, oh, well, we need to adjust this, and that, because this is the situation with your back. Then when it was time to get my next insurance, I had a waiting period of 2 years because they said, oh, well, your back has this problem. I'm like, no, it doesn't. I just went to the chiropractor just to go.
Dude.
And now you're penalizing me for trying to be preventative.
Yeah. And so I've been having that happen as well. Like some certain doctors, they'll just put it into your medical background without even discussing it with you. Like they're not diagnosing you. You just came in for an issue and now they put it on your medical background. There is a way to remove that by any means. You can always get a HIPAA form and have the doctor they're going to have to give you something in writing, like some legit paperwork from the doctor's office saying that, you weren't diagnosed. You just came in wanting to treat this or whatever, like, or that case. So that way they can remove that from your medical background. I know. It's a money game when it comes to doctors' facilities. Probably shouldn't say that. But
for me, this was for like a life insurance policy, but still they took into account the health situation. Wow. So by me just saying at the chiropractor, yeah, if you could just work this spot out right here, that played against me.
Wow.
That's crazy.
Got denied for life insurance.
All for your back. That's crazy. That's crazy. Alrighty. And then so when it comes to like your basic doctor visits, right, your checkup, things like that, those are considered basic coverage. Some people, and I talk to people all the time, they're like, I'm healthy. I don't go to the doctor at all. I don't want coverage for that. I don't want to have to pay this huge premium for something that I'm never going to use. And that is okay. Completely okay. But there are some things, especially as business owners, and say you have like a brick and mortar, like whatever the case is, you don't want to go through something that's going to either put you in debt and now you have no business to go back to, things like that. So it's really, really important to have something else in place in case something major does happen. So like for catastrophic coverage, whether that be heart attack, right, cancer, stroke, renal failure, permanent paralysis. People don't think about those things, but when it happens, it happens. We can't plan for them. And so always good to just have coverage. You can get coverage for these things separately outside of your traditional medical plans. So highly recommend it. And then when it comes to MD Anderson, it's the #1 cancer center in America, and it's right here in Texas at that. And so with them, you have to have insurance. They only accept a PPO network, which is kind of crazy. Like people will pay cash. They're like, I'll just pay you cash. MD Anderson is like, nope, you have to have a PPO. So when it comes to having coverage, make sure it's good coverage. That's all I can say. Wow. That's all I can say. I know. We never plan for them. We try to act when it does happen. Well, say for instance, it runs into your family, right? I found out through a realtor that I know, her makeup artist was like 31, 32, and heart disease ran in her family. And at 31, she suffered a heart attack.
Wow.
Yeah.
If you got diagnosed with cancer, you didn't have insurance, could you then go get insurance?
Through the marketplace.
Okay.
Through the marketplace, but through a private company, absolutely not.
Okay.
Yeah.
Because they would probably be like, no.
Right. Exactly. And cancer is pretty big, depending on what type of cancer, what stage it is,
Yeah.
That's why it's always good to have something in place. So at least, you get some type of coverage, but.
Yeah, that's scary.
Yeah.
And I used to work at MD Anderson, and in the cancer unit, you don't have time to figure it out. Like you better have it in place already because your stages can run through very quickly.
Oh yeah.
You hit a beat. So you don't need it.
That's true.
You don't have time for a waiting list.
Exactly. Like my life is at stake right now. But yeah. Any questions for me?
What's the difference between PPO, HPO,
I wanted to put that in there. Thank you. Thank you for asking that. I forgot to actually put that one in here. So PPO. So there's different networks when it comes to health insurance. PPO it stands for Preferred Provider Organization, meaning I prefer to go to this doctor. I want to go to this doctor. So it gives you the freedom to go to whichever doctor you choose to go to, whether you're traveling, if you move out of the state, like whatever the case is, it gives you the freedom just to go anywhere. Like you don't need a referral, you don't need to get it approved by the insurance company, all those things. You can just go as you will. When it comes to an HMO, Health Maintenance Organization, it literally sounds like what it is. They just maintain your health. So for like your annual physicals, things like that, you're going to be covered. But if you were to need to go to a specialist for like a podiatrist, right? I got foot issues. Then you have to go and get that referral. Wait for that referral to be approved. It's like a whole process.
Oh, so you just have to go to your primary doctor and then they get a referral from somebody.
Mm-hmm. Instead of going straight to them.
Which means pay the primary first.
Yeah. All right, all the fees and things like that, and sometimes when it comes to like specialists, it takes weeks sometimes to get into them, especially now. Ever since COVID, it's like months out, like those appointments.
And beyond the marketplace, like I'm currently on the marketplace, but I'm self-employed. My wife used to have insurance through the company. Now we're kind of on the marketplace. Is there any other way to shop for insurance, like as a self-employed person, like go directly to the company? Or?
Yeah, well, you can always go directly to the company. Probably wouldn't recommend it simply because I'm not going to say they're not going to find you. They're not going to find you deals, and they're just going to give you like just the basic copy paste plan. And likely it's going to be like the most expensive, to be honest.
So the marketplace is a good place to find the best deals, basically?
Or you can find an advisor, because that's what I do. So I'm a health insurance advisor. So I work with people. People don't have to pay me. I don't charge people to help them shop for coverage. But you can always find an advisor. They can help you shop. Like a good like discovery call, if you will. Just like let them know like what are you looking for, the things that you need, all those things. They can shop for you. They can shop for you.
Put people into like an affiliate organization where you can get the collective buying power of being with the company, but really you're all individuals that are all part of the same organization.
No, unless you are an actual small business that like a company's paying for it, then no.
Because I've seen it where, let's just say, let me just make up an example. AAA, right? Or AARP.
Yeah.
If you're a part of AARP, anyone that's a part of it gets this
Piece. Yeah.
So I've seen Facebook and Google advertisements where insurance agents are basically will put people into this organization group so they can get the buying power of a big, large organization.
No, I've never heard of that. Unless you're talking about like a health share plan, like those share ministry. Yeah, no, I don't do that, and I wouldn't recommend it. Just because they'll pay out a certain amount for different clients, like per like year. And if someone gets diagnosed with cancer, God forbid, but if something like that were to happen, they're only going to pay a certain portion, or maybe they'll try and reimburse you. I don't want to be reimbursed for paying out for cancer. That's hundreds of thousands of dollars. Yeah, wouldn't recommend it. So we did PPO, HMO, and then also on the marketplace, there's EPO network, stands for Exclusive Provider Organization. Works just like a PPO, but again, it's just exclusive. And especially in the marketplace, it's according to your zip code, right? So if you were to go like 2 towns over or 2 cities over, you probably wouldn't have access to doctors there. Exactly. And you'd be paying more. Yeah. So.
And then do you know anything about like health savings accounts, savings, stuff like that, help you save for deductibles and stuff like that?
Yeah. I just got into the HSAs, but what I've noticed is they're more expensive monthly for whatever reason. But I get it because you're
like a couple of plans that allow it.
Exactly, and teach its own. I don't think it's worth it, to be honest. I mean, if you can get a plan with no deductible, no like high copays, an HSA is not even gonna be helpful at all. But it's always something to look into.
Yeah, I used to do that. They had better options like years ago. And it
Right.
was pretty high deductible, but I used to do like cash out, basically.
Yeah.
And then I would use my HSA as like retirement. You know, you put money in there, you tax write off,
Mm-hmm.
and then you can invest that money too. That can grow in that account. And when you use it, it's tax free.
Yeah.
So it's like a triple tax advantage. And the idea is to have some money for your deductible or whatever. But there's a limited amount of funds that are
Yeah, and
HSA compatible.
right, exactly. Like the pool has definitely shrunk. I think I have access to maybe 5 plans that are compatible with HSAs, but
It's just all of them. I'm getting what you say, money.
exactly. It's all a money game. They don't want you to save money. That's the thing. Yeah.
They want your money.
They want your money. Exactly.
Yeah.
And then they want you to pay 50% health insurance.
Yeah.
Exactly.
I have a family member who got a low premium, I think it was low premium, low deductible through the marketplace,
Mhm.
but then when income tax season came around, he got charged.
They got
Because
penalized.
of he was getting credits.
Yeah, so you estimate your income.
Yeah.
And then if you go over that estimate, then you have to pay it back.
Yeah.
Because they're giving you credit.
Yeah. So well, something to look out for so you don't get those kinds of penalties when it comes to income tax season.
Oh yeah, for sure. I always tell people like whatever amount you think you're gonna get, like add like $5,000-$10,000 to that because you will be penalized. Like I had a small business owner who did the same thing, and no one can really predict if the market's going to be good for their business or not, right? And so he lowballed it. He put the exact same amount that he made the previous year, and they taxed him like $7,000 or $8,000. So he had to pay that back. Say it again.
He need a tax planner to help him.
I know one. But yeah, that's all I got. That is all I have. So again, I go by Mo, and this is my email address, my phone number. Comments, questions, concerns. I would love to answer.
You know, when you talk about self-employed, but what are some of the, I guess, what group of self-employed type of people come to you the most? Is there any particular, or is it spread out? Because here we are at an art collective.
Right.
Do artists love
Good question.
you the most?
I mean, anyone who feels a need to have health insurance, period. I can definitely say I work with a lot of travel nurses, like a lot of travel nurses. They get crappy insurance and they work on contracts. So it's like 3-6 months. And so every time they start a new contract, their coverage starts over. So they get a new premium. They start a new deductible. It's a pain in the ass. And typically the coverage sucks. So even if they were to on contract and maybe something happens where they have to go back home or something like that, that coverage isn't going to follow them back home. So I work with a lot of travel agents. Let's see. I've been working with a lot of HVAC folks. A lot of folks in HVAC. Some real estate agents. Let's see.
Another question. If I have health care plans through the marketplace.
Mhm.
If I wanted to change plans, like shop around with you or something and find a better plan, can I just do that anytime during the year? Or do I have to wait for like open enrollment?
That's a good question. So with the marketplace, you can cancel the plan at any time. I do not recommend canceling before you have something else in place, right?
You don't have to, yeah.
Right, exactly. But so with me, my open enrollment is year round. So anyone can, sign up or whatever the case is.
That open enrollment is just for the marketplace itself. Right?
Exactly. Yeah. Yeah, just for the marketplace.
So I couldn't sign up for another marketplace option.
Not until November. That's correct.
So, okay, so that's just their system.
That's their
So
system.
if I found something for you,
Mhm.
you could change mid-year or something.
Absolutely.
Okay.
Absolutely. And also for the marketplace, if someone were to move states or they just had a baby or something like that, some type of special event, right? There is a special enrollment for things like that. So
Would you say most people who are like entrepreneurs or, their own business, get a plan and stick with it, or do you feel like they change plan? I guess I was just kind of curious. Like once you choose, do people stick with that for a long time, or is there like
That's a really good
do
question.
better things come up and people's? I don't know.
Absolutely. That's a great question. I love that question. You can change as long as it suits you. If your lifestyle changes and you need like more coverage, less coverage, whatever the case is, feel free to shop. There's no contract. There's nothing binding you into this insurance plan at all.
Okay.
So yeah, you can always shop around. Always shop around. And for the people who stay for a long time, they're just probably just healthy and not using their insurance, most likely. That's typically how it goes.
Is there a benefit to staying with, like how, like car insurance, if you stay with the same company, for a long time, then they'll give you like discounts for loyalty.
Yeah.
Does that exist at all with health insurance?
Not for health insurance,
Okay.
no.
If you're not using it,
Yeah.
you're like, oh, I get this.
Yeah.
They're healthy.
So
We like,
what?
we're keeping
Get
them.
some points like for going to the doctor check-in.
Thank you for the
Yeah.
free money.
Yeah. I want like I want a punch card or something. Free gift at the end of the year.
Right.
You
For the
said
gift
that you
card.
don't charge like to come to you get some advice or
Yeah.
like you get paid through like a
Through the insurance companies, yeah.
You're like an apartment hunter,
Exactly.
but for health insurance. Health insurance
go.
hunter.
Health insurance hunter.
Is there any kind of aid to self-employed people who can't afford health insurance? So do you need like alternatives?
Any aid? You say aid?
So like
Yeah.
financial aid or anything?
Yeah.
Like
That would be the marketplace. So that's when your subsidies come into place.
So this is governmental program or what?
The marketplace?
Is this similar to what we were talking about if we were speaking about Obamacare?
Yeah, absolutely. Yeah. So yeah. So if you make, I would say like around like $60,000 a year, or like $70,000.
No matter where I live? Because this should probably be 130
Yes,
in Austin.
Well, if your income is considered low for them, then you qualify for a certain subsidy, meaning they're going to pay a portion of your premium. And some people find plans that have zero premium, right? You just got to shop. Yeah. Pay nothing a month. Yeah, it's
We
crazy.
But
did.
that's if you were like low income and you qualify because the government's.
Well, not necessarily low. I would say medium, because if you get low income, they're going to be like, your income's too low, maybe try the Medicaid or something like that. Yeah.
Oh, because Medicaid covers the lower portion.
Yeah.
We had MAP for a while long, right? What was it
Yes.
called? It was free,
Yeah.
For Travis County Medical Access Program.
but then I never
Oh,
went
MAP. Yeah, yeah.
to the doctor. I never used it at all, which is just it's
But
funny.
that's because you chose, right? It's not because you couldn't.
No, I just didn't feel the need to go to the
Well, let me
doctor.
use your map.
Exactly.
Just-
That's a lot of people. That's a lot of people.
It's just like go to the eye doctor. That's about it.
That's all I have, y'all.
Anyway,
Thank you.
Of
thank
course.
you.
Thank you.
Always wear orange shirts?
I don't, but I'm trying. I was just talking about this. I was just saying I'm trying to rebrand, and I'm